Good morning, and this is the Durham Chapter of Continentals, and this is our monthly Good Health Wins project. With the uptick in COVID, we decided we want to get together and just reflect on COVID and get ourselves prepared for this upcoming season. We are currently at Toddlers Academy in Durham, North Carolina, and Toddlers Academy is owned by one of our Continental sisters. I'm going to, at this time, allow everyone to go ahead and introduce themselves and tell them how long they have been Continentals. I will start with myself. I'm Forsythia Powell, and I have proudly been a Continental for 27 years.
I'm Dolores Plummer, and I've been a Continental for 43 years.
I am Rosa Nolan. I have been a Continental for over 20 years.
I'm Addie Parker, and I've also been a Continental for over 20 years.
I'm Lydia Whittick, and I've been a Continental for 43 years.
I'm Brendolyn Morris, and I'm a charter member, and I have been a member for 44 years.
Hey y'all, I'm Saber Morris, and I have officially been here almost a year.
I'm Charmaine Grafton, and I've also been here almost a year.
And I do want to take this time to thank my sisters for joining for this discussion this morning. All of us want an opportunity to share our experiences during the pandemic. We find that everyone's experience will have some similarities, but it also will be a unique experiences, and our thoughts about it will also be very specific to us. So I'm going to allow my sisters to get started with the discussion on their feelings during the pandemic and just share.
I'm Lydia Whittick, as I said, and I would like to share my experiences from a business standpoint. We didn't have any major problems, but then we decided that we were going to follow the law to the T. Remain very transparent, keep everything very sanitized, very sterile, and everyone had to wear masks. A number of centers closed down. We never closed down. We had a few isolated cases where we had to immediately remove them. One thing that helped, our teachers knew they were going to be paid, but they needed to be sure that they were doing what they were supposed to do, and they did. And for that, I'm very proud, because had they not, we couldn't have remained open. The children do what they see teachers do. They enjoy wearing the mask. Those who did not wear them, we kind of ignored that. So for the most part, we didn't have any major problems, and we were one of the blessed programs.
COVID was, to me, a very scary thing because a lot of people that I knew or that I was familiar with did get COVID. Lots of them passed on. And this let me know exactly how scary, how dangerous, how serious it was as far as just trying to remain healthy. It also gave us an opportunity to be at home with our families more than we normally would have been, doing things as a family, growing closer together, and just the opportunity to love each other more and appreciate each other. And as far as the immunizations, I have never been big on shots. Still not, but I want to leave. So I've been getting the shots, the boosters, and anything else affiliated with it, and we will continue to do so. And I encourage everyone else to do the same.
To kind of piggyback off that, like COVID for me allowed me to do a lot of self-care and kind of personal development, and like Miss Brendolyn said, like spending time with family. And sometimes it was a little depressing, kind of not being able to go anywhere, because there was a point in time where we just couldn't go anywhere. We had to be at home, and to have to be at home on a lockdown, not being able to go where you wanted to go because you had to be in the house was like kind of, was depressing a little bit. But once we were able to go outside, once, they said you can go outside and wear your mask, it made it a little bit better, but I just never in my life would have imagined that I would experience a time where I'm not able to go outside of my house, where I was being told that I couldn't go outside. That was one of the defining moments for me with COVID, but it did allow me to do a lot of self-reflection and personal development during that time.
I took it seriously, as everyone else did. I took all my shots. I did not, per se, stop going as much as I usually do. But yes, I took it very serious, and I had daughters who stayed on me for whatever the reason that they thought I should have stayed. But yes, COVID is a thing that I'm still paying attention to. And I think everybody I know is paying attention to it.
Well, for me, COVID will always be a reminder of the worst time in my life. During the early part of COVID, my husband died. He did not die from COVID. But when a person died during that period of time, there was not an opportunity to pay them the respects that you normally would. People were having graveside funerals, and everything was very, very, very limited, and people were very scared to be around people. And also during that time, my best friend from college died from COVID, and my best friend from high school died from COVID. So it will always be on my mind as a very, very hard time. And so I will remember COVID forever and the challenges that it faced in my life. Because during that time, it created a lot of isolation for me because of what we were required to do.
I have never experienced a disease that affected the entire world. COVID affected the entire world. And it brought along with it loneliness, depression, isolation, getting false information. It was just so much going on that we as people were confused. But we saw so many of our friends and families and heard of people dying, and it was just really frightening. I see COVID as something that I would never, never forget. It affected so many people. Millions of people died from COVID. And I would like to say that also we invented new wheels during COVID. I have never worked from home in my lifetime, and I had to work from home, and that was like a new experience for me, and I love it now. I'm still working from home, and I think that we had to reinvent new wheels while we were in COVID. And it really brought about some people thinking about changing their careers and just thinking about life in general in a really totally different way. So it was an eye-opener for everyone to just be in COVID and just seeing that, wow, how one disease can change so many people's lives. And it was just unbelievable. So I think COVID has affected us in many, many different ways. It also brought about us seeing that injustices in the healthcare system. We saw where people got certain medications because they had certain certain insurance policies or had certain positions, and they were called privy to certain medications. So it was just really an eye-opener to the world and to us to see the injustices we have in the healthcare systems also. Thank you.
Well, I lost a lot of people close to me in my family. In one family, I lost two sisters and brothers. Two sisters died the same day.
Oh, wow.
Yes,
Did they die from COVID?
yes.
They died from COVID.
And the father also died.
And the father
Yes, he's
also.
my first cousin. Yes.
Wow.
You know, piggybacking off of what some of you have said about losing loved ones, excuse me, I had a 22-year employee who ended up being a long hauler, as they call it, and she passed away from COVID. That was extremely painful, very painful. I mean, she was like a daughter to me. So even though we did well with the business, I think COVID was bad for all of us. And it was especially bad for me on a more personal note, because I went to the hospital for a procedure, doing just fine. The doctor said, well, have you been tested for COVID? I said, no. He said, you want me to test you? I said, well, why not? On a Friday, he called me on Sunday. He said, you just may as well get your little self right back out here because you have COVID. I said, I know. Well, you lying. I said, I am not sick. I know you're lying. He said, numbers is good. You need to come back. And today, I have not felt sick. This was before they admitted that COVID was here. I'm not really sure if they even knew what they were doing when they kept me for 5 days.
Wow.
And I was up and about, did just fine. So lots of questions about it, yes. But you just kind of go with the flow. So yeah, I've had some experiences with COVID, personal as well as business. But I thank God I'm still here.
I don't have any personal experience with COVID, just as far as being a parent and them closing down schools and implementing online or remote learning. It's kind of good and bad if you have children who are attentive and are able to focus on online and not YouTube or other videos, then it's beneficial. My girls actually flourished, strangely enough, with the online atmosphere. The only concern that I have or drawback because of that is that we don't have any time away from each other. You don't get the chance to miss each other. Like if you go away and then I missed you today, you didn't get that feeling. One of the benefits, not from a school aspect, but the work aspect, I have always been against working from home. If it snows, I don't have to work because I don't have to go to the office. But because of working from home, like my other sisters have stated, it gives you the chance to self-reflect. I cook dinner earlier in the day, so by the time they're out of school or by the time work is done, dinner's already prepared. I've kept my house clean. I'm able to multitask while I'm at home, and I have gotten accustomed to now where I can go get my nails done while I'm at work. I can, there's a lot of other things that came from COVID that you can look at it in a different light. I know when they first started implementing the shots, they were telling you had to be of a certain age or a certain this or a certain that. I was still hesitant about getting the vaccination just because, just like with any other shot, you don't know what's in it, you don't know how it's going to impact your body. I got the shot and I didn't have any impacts from it. So I took my children, they both got the shots. Not really any major impacts aside from like the numbness of the arm and like excessive sleepiness for the next few days. But everybody bounced back from it in my household. None of us were sick for that whole time we were out, which I thought was amazing. And that also speaks to just in general germs and cleanliness at schools, because like at Miss Lonita's school, a lot of schools are not as clean and on top of sanitation like she is, because just during a regular school year, your kid will come home with a runny nose. And while they were out with COVID or during that COVID pandemic, none of us were sick. So I think that speaks a lot to what needs to continue to happen and what people need to focus on as far as cleanliness, not just in the school systems, but at home and at the store, wherever you go. But I think it had a lot of good and bad as far as us having to experience that. And like has already been stated, who would have thought something like this would happen and could possibly happen again?
It also affected our children's social skills.
Exactly.
And now some kids really don't know how to interact with other people.
Exactly.
So this is, like I said, it was an eye opener. Some people are going to therapy now because of this pandemic. And it's just really eye opener to let us know that God is in control. And He is putting us here to realize that He is the one that has the final say so. And He is giving man the knowledge they need to help keep us here longer, as long as we can.
Miss Lolita,
Yes.
this is a random question. With you working with toddlers and smaller children, have you noticed, like if you had children transition in, the difference in their social skills?
I was about to say that. There is a difference. A child who has been at home or work at home or in a TV environment is going to be less social. So there is a difference. Unfortunately, it's a negative.
Absolutely.
So ladies, I want to just thank you for freely expressing how you feel about the COVID pandemic. And all of you brought out some very specific experiences and shared some very interesting information about COVID. I know we could talk about COVID for days because it just had that type of impact on our lives. So what I'd like to do now is, many of you have already mentioned about the vaccines and everything like that. I want to ask you a specific question about vaccines. How do you feel about vaccines now as a result of the COVID pandemic? We hear that there is an uptick in COVID cases. I think that got all of our attention, I'm sure. So with that, there's going to be a new vaccine coming out. And so I want to know, how do you feel about them as a result of them? Let's say, how did you feel before, and how do you feel now about vaccines?
Well, I've always felt that you should be vaccinated. From way back, you just are vaccinated. We don't know the negative parts of it, but then we don't know that about anything.
Right.
So if, I think it was like Dr. Fauci said, and I want to quote him, but if this is something that will save your life, or you think will save your life as a result of research, why question it? That's how I feel about vaccines. And then if you get the vaccine, maybe that lessens the chance of spreading. So I'm in favor of vaccine. And we will be wearing the mask again here at school starting this fall.
I too am in favor of vaccinations. And I think we go back, looking at when flu broke out way back when. Now flu is a required shot that we take, well, not required, but they ask you to take a flu shot every year. And I feel like the COVID-19 might come to that particular journey too, where we are asked for your safety to take a COVID-19 shot. So I feel like the COVID-19 shot should be something that you should take, because you got to look out for your family members, especially the young and the elderly. And they put a lot on the elderly because they have so much, their systems can be compromised. So it's very important, in my opinion, for us to continue with the COVID-19. I understand there's one coming out this fall, and I am planning to take it, and I'm gonna try to get my dad to take it too. So I just want to, for the safety of others and for my own safety, because I don't know, I'm around different people, and I don't know if they've had the shot or not. So I'm trying to protect myself, my family, and my friends and people that I associate with, so I will not give them something that will compromise their system.
Well, I'm planning on getting the shot. Very early, a couple of years, I was hesitant about taking the flu shot. However, after that, I thought about it seriously, and then I began to get it every year. So every year I get the flu shot. I've had all the COVID shots except that last one, which I plan to get before now. However, I am going to take this new shot that's coming out, if they will permit me to do that instead of that last COVID shot that was to be given.
Well,
before COVID, I never thought about vaccinations. The doctor thought about them for me. When I would go to the doctor, she'd say, you need to get your flu shot, you need to get your pneumonia shot, you need to get this shot. And I'd be like, okay, but I wasn't proactively thinking about vaccinations, honestly. I guess in my mind it was the doctor's job to think about it for me. So I didn't even think, I can honestly say I spent not one day thinking about a vaccination. Not for me. Now when I had kids, yes, I thought about it for them. But when the COVID vaccine came out, I didn't spend not 1 minute not thinking about getting it. When I got my first 2 vaccines, I drove to Greensboro to get them because I couldn't get an appointment here in Durham. And my kids was just on me every day about it. Mommy, you need to get your vaccine. You need to get your vaccine. And so I said to them, instead of telling me I need to get it, can you help me get an appointment? And so my daughter, she said, she lives in Greensboro, she said, I got you an appointment. And here's where you're gonna go. I'm gonna get you there that day to get your vaccine. So if you got your first one there, you had to go back and get your second one there. So, but what it taught me was not about vaccines so much, is that to be more proactive in my own health care. I own my own health care. I can't wait on going to the doctor. The doctor saying, well, for Cynthia, you need to get blah, blah, blah. So now I am on it. I keep up with the vaccines and all of this as if my life depended on it, because I realized during COVID, this is serious. I could die. I could just die. And so I am very, very, very in tune to getting vaccinations. I will be getting whatever they say you need, whatever is recommended for you to get. So that's my particular story about vaccines and how I felt about them before and how I feel about them now. And I encourage everyone when I'm talking to you, you need to get your vaccination. And that's part of our commitment as part of the Good Health Wins Project, to make sure we are focused on keeping our family, friends, and community safe. And so how we do that to a large part is to encourage them to get the shot. Ask them, did you get the shot? Because number one, I don't want to be around you if you haven't had your shot. I'm just sorry. I don't know what you walk around with. I just don't. I had to tell my sister, I said, oh, you need to get the shot. Well, I can't be messing with you. She's like, she took that thing serious. She got that shot, I tell you that. So that's just my opinion about the vaccines and being very proactive about my own health care in terms of getting the vaccines.
I have to say, I have one daughter. I don't know. That young lady, she is, for the lack of a better word, very, very serious about taking care of yourself in that COVID. And she's very serious about not wearing, you know how sometimes you wear something today and you put it on tomorrow? No, ma'am.
Clean clothes.
Clean clothes. It's supposed, if you wore it today, it's got to go in the dirty clothes.
I don't really know if my thoughts on vaccinations have changed. I think now I'm more aware. Because like I said, as far as parenting, I make sure that my kids have all of the required shots for school and that kind of thing. I was hesitant about the COVID vaccination just because I felt like it was something that they generated overnight. Even though I knew the severity behind it because of the way they reported on the news as far as deaths and the count as far as people becoming sick, I was still hesitant about it. Even though initially I was reluctant to get the shot, I'm glad that I did. I don't know. I don't really think my thoughts have changed. I know if it's something that we have to have or need to have, they're definitely gonna get it. Me personally, if they do offer another vaccination for COVID, I think I would be in line to get it as well. And that kind of goes to what y'all was saying, kind of tying it into the flu shot and it possibly being something that you can see cycling back every year because of the new strains. I ain't never had a flu shot.
Either. I personally, I am one who is not in favor of vaccines. I did get the COVID shot, but I did also wait until the very last
So
minute because I needed to see all of the research. Like I needed to see, like I also felt like this is something that they just threw together. And yeah, I just got to do my research because I need to know what I'm putting inside of my body. And just because you tell me I need to do it, that doesn't mean I'm just going to do it. I need to know what's going inside of my temple because this is the only one that I have. So while I did get it, like whatever this new one is, I'm going to let y'all know, I ain't jumping to the store to go get it on day one. I'm going to see how it'll fit everybody around me first.
You gonna see if we die first.
yes.
I got you. You gonna see if we die. So the theme from the Good Health Wins Network this year is called 3 for Me. And I want you to put your hands up and say 3 for me from Good Health Wins. And the reason why is that although you may not have to get all these particular shots, you want to be a messenger for your family and your friends if you need to do your research. Now, if you need to do your research, I understand that. But we want to put up for 3 for me from the Good Health Wins Network. Encourage our family and friends to be a part of getting their vaccinations for this upcoming season. So ladies, any final thoughts that you want to share? Something you thought about while we've been talking about vaccines and getting the vaccines? And we already know how some of you are going to proceed with the vaccine based on our discussion. So
I only got to get 2.
you only got to get 2. Your job, though, is to encourage and make sure that your family and friends over the age of 60 are aware of the RSV and that they get it.
So is it just over 60? Is it not for the children?
It's for the children always, but 6 months. But this year, a heavy focus is on the age group of 60 plus because this is new for us. This is a new vaccine for us. So we need to be getting as much information as possible. I think the thing about it is that we need to be mindful. And you've seen it on the commercials about RSV on the TV. You might not be very focused on it because, like many things, you just can't focus in on everything. There is a lot of information out there about it. The best source for all of us is to check with your doctor. And the second one is check with your doctor or pharmacist about these. And then, of course, you want to talk to your family and friends about it so that, you can exchange information and thoughts about it. So I want to take this opportunity to just thank you for participating in our Good Health Wins monthly discussion. And I look forward to our next time. Thank you, ladies.
Thank you.